Hey guys, welcome back to my channel. Today we're going to be talking about med-surg nursing versus ICU nursing. Just for reference, I am currently an ICU nurse. I have worked step down, med-surg, and now ICU. I've been a nurse for 3 years now, so if you're interested in seeing what I have to say, continue to watch. If you're new here, don't forget to hit the subscribe button so you never miss a video, and don't forget to turn on your notifications. All right, let's get into it. So, med-surg nursing, let's just go there first. Med-surg and ICU are completely different worlds. Nursing is nursing, but the specialties are completely different. With med-surg nursing, medical surgical nursing, you normally have more patients. And so places that I've been, I've had anywhere from 4 patients to 6 patients. 6 patients obviously is a little more hectic, especially during the daytime. Lots of med passes. If there's any procedures or tests, you have to get your patients ready for those. Family, so there's, possibly 6 families now that you're interacting with while trying to care for your patients. It's just a lot busier. It's a lot more going on, but I feel like med-surg nursing is just more of a general overview. You're not dealing with like intubated patients or dealing with really doing a lot of invasive hemodynamic things. So I feel like there's a separate set of skills, but for me personally, I feel like being med-surg nursing is more of like general, you might have post-surgical patients after they've already been in PACU or the post-anesthesia care unit. You might get patients from the ICU. So med-surg, you'll have more stable patients. Step down is where you'll have like those intermediately stable patients. They're not sick enough to be in ICU, but they're not stable enough to be med-surg. With med-surg, you have a lot of discharges. People are going home or back to their long-term care facilities. And I just kind of feel like it's just a little bit busier. Well, I wouldn't say busier than ICU, but it's a different type of busy. I feel like with med-surg, there are a lot of tasks because, like I said, you have discharges, you have med pass, you have patients going to surgery, coming from surgery, you have more family most of the time. There's a lot of PTOT, and your patients are wanting to get up. I mean, they're awake, so they wanted to get up and move around, and sometimes you have to feed your patients. And so I just feel like it's a lot of tasks. Med-surg is very task heavy. When I was working med-surg back in 2021 and I worked at my first job, we only had 4 patients. It was med-surg mixed with step down. And for me, that ratio was pretty okay. 4 patients, and a lot of the times we didn't have a lot of total care patients. So our acuity wasn't really that high. So I feel like it was a good first job for a new grad nurse, and I got the basis of my skills. I feel like with med-surg, you pretty much learn how to do everything. You're putting in Foley's, you're putting in IVs, you're managing colostomies, like all the basic foundational nursing skills I feel like I got from med-surg, and that was really good for me. And I also learned time management. So as far as some people say, where should I start, med-surg first or ICU? It really it's up to you. Both of them are great specialties. But I do think coming from med-surg did set me up well to go into ICU. I would say that if you go to ICU first and then you think you might want to try med-surg, you might have more issues trying to balance your time better, because with ICU, you normally only have 2 patients and you have a lot more resources in the ICU as far as, respiratory therapy and then the doctors or the PAs and stuff like that. So I feel like if you go from ICU to med-surg, there's usually a lot of people say they have issues with time management and kind of just the busyness of it all. But either way, no matter where you start, it'll be fine. I started med-surg and then went to ICU, and I feel like I've done fine. But I will say with med-surg, I did get a lot of the basic foundational skills, nursing practice skills. And so now, switching gears to ICU. ICU, I feel like, is a lot more in-depth and more detailed. You have about 2 patients. Sometimes you'll have 3 patients, and they call that being tripled. But usually they try for staff nurses to have about 2 patients at the hospitals that I've been to and where I currently work now. They try to keep staff at 2 patients, and travelers, they will triple if they need to, and sometimes they'll triple staff if they need to. Just depends on the census of the unit. So ICU, your patients are a whole lot sicker. They're usually intubated, so they have that tube down their throat. And usually sedated if they are intubated. So propofol, fentanyl, Versed, ketamine, whatever is working for them. At my facility, we usually do propofol and fentanyl to start, and if we're still having issues with adequately sedating the patient, then we'll move on to other drips. So like I said, you have the intubated and sedated patients. We usually, in my ICU, we recover liver patients fresh out of the OR. And so at that point, you'll be one-to-one with that patient for, I think, at least 24 hours of that patient stay in the unit. And because there's just so much to do, and there's so many subtle things that you have to be able to look out for. And so with ICU, there's a whole lot of a lot more critical thinking, I would say, because your patients are so sick, there you have to really look at any subtle changes, like any subtle changes in the labs or blood pressures or urine output. So you really, really have to be paying attention. And I do like that part because I feel like I use my brain all the time and I'm learning all the time. So I do like ICU better personally. And also I'm just more of an introvert. And so intubated and sedated patients doesn't sound terrible to me. And you still have family that comes around in the ICU. I would just say it's not really as much, especially for me. I work night shift, so we really don't have a lot of family that stays the night. Sometimes we will, but we only have a rule where only one family member can stay the night. So that does help as far as like workflow and actually taking care of your patient, because sometimes, you know, you're trying to take care of your patient, you're trying to help the family, you know, make them feel comfortable as well, answer any questions that they might have. And if they're, you know, completely new to being in the hospital or whatever the disease process is, you could potentially be spending a lot of time, you know, answering questions and doing other things, which is completely fine. But I think me being an introvert, and I like to be able to do my job. And so I think ICU has been working better for me in that aspect, as well as working night shift. Also in the ICU, like I mentioned earlier, you'll have more resources. So like at my unit, we have the physician assistants all night. They're usually on the unit. We have respiratory therapy on the unit. So if we need anything as far as like with the ET tube or any trach issues that we're having, RT is there and they can just immediately troubleshoot or help us. Or if we're intubating a patient, we're not having to call respiratory, like they're on the unit. So I think that's really nice. It makes me feel better knowing that I have my resources readily available. With ICU also as well, you will see, I won't say more codes. For me personally, I feel like I did see more codes when I came to ICU. But that could have been the acuity of where I was working before as well. I wasn't working at like a level 1 hospital. It was a smaller satellite hospital, so maybe the sicker patients got sent to the big hospital. So it could have also just been where I was working. But in my personal experience, I feel like I have seen more codes and been a part of more codes. I didn't have my first patient code until I came to ICU. So, so there's a lot more because there's sicker patients, so there's more codes potentially. We're doing a lot of like sepsis bundling, and I feel like there's a lot more interdisciplinary collaboration and just a lot more of teamwork collaboration as well. Like, I feel like when I came to ICU, I saw more nurses helping one another. And that could be because they might have had the time, because we only have 2 patients and sometimes our patients aren't as sick. So maybe they have more time to help, versus when I feel like when I was on Med-Surg, there wasn't a whole lot of teamwork that I saw on the units that I was on. But like I said, people had anywhere from 4 to 6 patients, and that is a lot to deal with. So, and you're only one person. So I do understand that. But like I said, I feel like there's more teamwork in the ICU. If there's a new admission or if there's a code, everyone's running to your room to help you. And I really like that, especially being new to the specialty. I've been in ICU for about a year now. And it's still the same since day one. A lot of people running to your room to help you with anything you need. The charge nurse is always available. The charge nurse at my unit does not take patients normally. And so you always have that person that's available. And so, yeah, I just feel like those things are strikingly different from when I was on med-surg floors. And I do really appreciate that. There are a lot more of invasive procedures or things happening in the ICU, I feel like arterial lines and stuff like that, and then doing continuous renal replacement therapy. And so, like, in the ICU, we're running the continuous dialysis machine every day, all day, which I never saw on med-surg because we would have dialysis nurses come to the floor. So there's more invasive things going on. You literally put in the PAs and doctors put in central lines at the bedside. You intubate right at the bedside if you need to. There's just kind of a lot more like adrenaline rushing things, I feel like, that happen in the ICU. So if you're an adrenaline junkie, you might like it there, or you might like the ED or something similar. So yeah, that's all I have for today. If you guys think of anything that you have noticed working med-surg or ICU that I didn't mention here, feel free to drop that in the comments. I would love to read your comments. I love interacting with you guys, and I'll see you on the next one. Bye.